Family caregivers play a critical role in caring for patients with advanced cancer. We know from research that family caregivers experience substantial quality of life deterioration and burden from caring for their loved ones. And we know from studies, there have been several randomized trials showing that early integration of palliative care for patients with advanced cancer leads to improvement in quality of life, symptom burden, mood, and the quality of end-of-life care. However, what we don't know is the effect of integrating palliative care on family caregiver outcomes. So we are reporting a study, a randomized controlled trial of integrating palliative care for patients with newly diagnosed lung and GI cancers and their family caregivers. Patients are randomized to receiving palliative care integrated early from the time of diagnosis along with their standard oncology care, and patients are seen by palliative care clinicians on a monthly basis during the entire study period. Patients randomized to the standard oncology care alone received palliative care based on their request or the request of their providers. And so patients that were randomized to the intervention had family caregivers who may or may not have attended these visits, these palliative care visits, with the patient. What we found in this study that family caregivers of patients randomized to the intervention had improvement in certain aspects of their quality of life, specifically their vitality and social functioning, and they also had improvement in their depression symptoms at 12 weeks post-intervention. So this is really the first study to show that integrating palliative care in the care of patients with advanced cancer can lead to improvement in family caregiver outcomes. And we also found that it appears to be that some of the benefits that family caregivers are experiencing is really due and is partially mediated by the effect of the intervention on patient outcomes. So as patients are feeling better, the family caregivers are also feeling better.